Sleep and sleep disorders, meaning, symptoms, causes, and implications. Welcome to the Ultimate Wellbeing. Ultimate Wellbeing is a health and well-being channel. The Ultimate Wellbeing Channel will help to improve your health and well-being. On this channel, you will see videos promoting good health and well-being that will assist you to improve your health and well-being to ensure your ultimate well-being. If you are new here, make sure to subscribe to our channel to get a regular dose of good health and well-being tips to become a better you for ultimate well-being. Relax, have fun as you see our videos and become a better you for your total well-being. Thank you. Sleep and sleep disorders, meaning, symptoms, causes and implications are discussed in this video. Now, let us start. Meaning of sleep. Sleep is as essential for good health as oxygen, food, and water. Most scientists agree that sleep is important for restoring physical and mental health. It refreshes the mind and repairs the body. Lack of sleep, or sleep deprivation, can cause fatigue, poor concentration and memory, mood disturbances, impaired judgment and reaction time, and poor physical coordination. The body's internal clock regulates when and how we sleep depending on the amount of light around us. When the sun sets, your brain releases hormones to make you sleepy. In the morning, exposure to daylight suppresses these hormones and releases brain chemicals to keep you awake. Getting enough sleep. Today, sleep deprivation is common in developed nations, with the average adult sleeping for only 6 or 7 hours each night. The Sleep Health Foundation recommends that adults should aim for 7 to 9 hours of sleep per night. Most of us feel that we have not had enough sleep at least some of the time. It is thought that sleepiness causes about 1 road accident in 6. Studies show that common distractions from sleep are the internet, texting and social media, parenthood, shift work, travel across time zones, illness, poor sleeping habits, and some medications. New parents lose, on average, between 450 and 700 hours of sleep during their child's first 12 months of life. Sleep stages. Sleep is not a static, unchanging state of consciousness. The brain moves through distinct stages of sleep, over and over, every night. The 2 broad categories of sleep include rapid eye movement, REM, sleep and non-rapid eye movement, NREM, sleep. Rapid eye movement, REM, sleep. Rapid eye movement sleep occurs regularly during sleep, about once every 90 to 120 minutes. It makes up about 1/4 of your night's sleep. The brain in REM sleep shows significant electrical activity. The sleeper's eyes tend to dart about under closed lids, hence the name. Most dreams are thought to occur during REM sleep. Sleep researchers have established that at least some eye movements correspond with dream content, which suggests that we watch our dreams like we watch movies on a screen. REM sleep makes up a larger proportion of the total sleep period in babies, especially premature babies, which suggests that dreams help to mature a developing brain. Non-rapid eye movement, NREM, sleep. Non-rapid eye movement sleep is what you experience for the remaining 3/4 of your sleep time. The amount and type of NREM sleep vary with age and the degree of sleep deprivation. The 4 broad stages of NREM sleep include: Stage 1, dozing or drowsiness, you hover between being asleep and awake. Stage 2, you lose awareness of your surroundings, and body temperature starts to drop and your breathing and heart rate will slow down. Stages 3 and 4, deep sleep, also known as delta sleep. Your blood pressure, heart rate and breathing become very slow and your muscles relax. Growth and repair processes occur during this stage. Sleep disorders. Sleep disorders are conditions that result in changes in the way that you sleep. A sleep disorder can affect your overall health, safety and quality of life. Sleep deprivation can affect your ability to drive safely and increase your risk of other health problems. Some of the signs and symptoms of sleep disorders include excessive daytime sleepiness, irregular breathing, or increased movement during sleep. Other signs and symptoms include an irregular sleep and wake cycle and difficulty falling asleep. There are many different types of sleep disorders. They are often grouped into categories that explain why they happen or how they affect you. Sleep disorders can also be grouped according to behaviors, problems with your natural sleep-wake cycles, breathing problems, difficulty sleeping or how sleepy you feel during the day. Some common types of sleep disorders include 1. Insomnia, in which you have difficulty falling asleep or staying asleep throughout the night. 2. Sleep apnea, in which you experience abnormal patterns in breathing while you are asleep. There are several types of sleep apnea. 3. Restless legs syndrome, RLS, a type of sleep movement disorder. Restless legs syndrome, also called Willis-Eichbaum disease, causes an uncomfortable sensation and an urge to move the legs while you try to fall asleep. 4. Narcolepsy, a condition characterized by extreme sleepiness during the day and falling asleep suddenly during the day. 5. Sleep restriction/insufficient sleep/sleep-related habits that reduce sleep time. 6. Perisomnias are a class of sleep disorders that cause abnormal movements and behaviors during sleep. Perisomnias include sleepwalking, sleep talking, groaning, nightmares, bedwetting, teeth grinding, and jaw clenching. 7. Circadian rhythm disorders where the desire and ability to sleep are out of phase with the 24-hour social environment, such as jet lag and shift work sleep disorder. 8. Periodic limb movement disorder and restless legs syndrome. 9. Snoring and obstructive sleep apnea. Symptoms of sleep disorders. Symptoms of sleep disorders include being very sleepy during the daytime and having trouble falling asleep at night. Some people may fall asleep at inappropriate times, such as while driving. Other symptoms include breathing in an unusual pattern or feeling an uncomfortable urge to move while you are trying to fall asleep. Unusual or bothersome movements or experiences during sleep are also possible. Having an irregular sleep and wake cycle is another symptom of sleep disorders. Causes sleep disorders. There are many conditions, diseases, and disorders that can cause sleep disturbances. In many cases, sleep disorders develop because of an underlying health problem. Here are some causes of sleep disorders. 1. Allergies and respiratory problems. Allergies, colds, and upper respiratory infections can make it challenging to breathe at night. The inability to breathe through your nose can also cause sleeping difficulties. 2. Frequent urination. Nocturia, or frequent urination, may disrupt your sleep by causing you to wake up during the night. Hormonal imbalances and diseases of the urinary tract may contribute to the development of this condition. Be sure to call your doctor right away if frequent urination is accompanied by bleeding or pain. 3. Chronic pain. Constant pain can make it difficult to fall asleep. It might even wake you up after you fall asleep. Some of the most common causes of chronic pain include arthritis, chronic fatigue syndrome, fibromyalgia, inflammatory bowel disease, persistent headaches, and continuous lower back pain. In some cases, chronic pain may even be exacerbated by sleep disorders. For instance, doctors believe the development of fibromyalgia might be linked to sleeping problems. 4. Stress and anxiety. Stress and anxiety often have a negative impact on sleep quality. It can be difficult for you to fall asleep or to stay asleep. Nightmares, sleep talking, or sleepwalking may also disrupt your sleep. How are sleep disorders diagnosed? Your doctor will first perform a physical examination and gather information about your symptoms and medical history. They may also order various tests, including 1. Polysomnography, PSG. This is a lab sleep study that evaluates oxygen levels, body movements, and brain waves to determine how they disrupt sleep versus home sleep study, HST, that is performed on your own and is used to diagnose sleep apnea. 2. Electroencephalogram, EEG. This is a test that assesses the electrical activity in the brain and detects any potential problems associated with this activity. It is part of polysomnography. 3. Multiple sleep latency test, MSLT. This daytime napping study is used in conjunction with a PSG at night to help diagnose narcolepsy. These tests can be crucial in determining the right course of treatment for sleep disorders. There are many ways to help diagnose sleep disorders. Doctors can usually treat most sleep disorders effectively once they are correctly diagnosed. Treatment of sleep disorders. Treatment for sleep disorders can vary depending on the type and underlying cause. However, it generally includes a combination of medical treatments and lifestyle changes. 1. Medical treatments. Medical treatment for sleep disturbances might include any of the following: sleeping pills, melatonin supplements, allergy or cold medication, medications for any underlying health issues, breathing device or surgery, usually for sleep apnea, and a dental guard, usually for teeth grinding. 2. Lifestyle changes. Lifestyle adjustments can greatly improve your quality of sleep, especially when they are done along with medical treatments. You may want to consider incorporating more vegetables and fish into your diet, and reducing sugar intake. Reducing stress and anxiety by exercising and stretching. Creating and sticking to a regular sleeping schedule. Drinking less water before bedtime. Limiting your caffeine intake, especially in the late afternoon or evening. Decreasing tobacco and alcohol use. Eating smaller low-carbohydrate meals before bedtime, and maintaining a healthy weight based on your doctor's recommendations. Going to bed and waking up at the same time every day can also significantly improve your sleep quality. While you might be tempted to sleep in on the weekends, this can make it more difficult to wake up and fall asleep during the work week. Conclusion. Sleep and sleep disorders, meaning, symptoms, causes and implications have been discussed in this video. Sleep is essential for your health. It refreshes the mind and repairs the body. Lack of sleep can cause fatigue, poor concentration and memory, mood disturbances, impaired judgment and reaction time, and poor physical coordination. It can also put you at more risk of accidents and injury. Long-term lack of sleep can be associated with an increased risk of diabetes and obesity. Common causes of sleep deprivation are parenthood, shift work, travel across time zones, illness, poor sleeping habits, some medications and late-night usage of TV, the internet, and social media. The effects of sleep disorders can be so disruptive that you will likely want immediate relief. Unfortunately, long-term cases can take a bit more time to resolve. However, if you stick with your treatment plan and regularly communicate with your doctor, you can find your way to better sleep. Hope this video is useful and beneficial to you. We love to hear from you. Please post your comment below in the comments section. If you are new here, make sure to subscribe to our channel and press the notification button so you can get a regular dose of good health and well-being tips to become a better you for your ultimate well-being. If this video has been helpful and beneficial to you, give it a thumbs up, share it with your friends and leave a comment below. Kindly note that any information on this video is provided for educational purposes only. Diagnosis and treatment decisions should be made in consultation with your doctor. Thank you. Thank you for seeing the Ultimate Wellbeing videos.